Evidence-based research shows now that seniors and older adults that live in independent living, assisted living, memory care, and even some skilled nursing settings, they just experience better health and well-being outcomes. We know they live longer, they have a lower mortality rate, they have better access to healthcare services, and those healthcare services are more likely to be delivered in their residence, which is just phenomenal. The findings from the frailty study were simply remarkable. So we looked at a 2-year period, 1 year prior to a move into senior housing and 1 year following the move. And what we see is that frailty levels start to rise in the months leading up to a move into senior housing. But about 3 months after that move, frailty levels taper off and they ultimately improve for residents. And that really emphasizes that there's wellness programs, there's healthcare delivery that can be delivered in senior housing communities that help improve the frailty levels of residents. It piqued our curiosity after we saw that frailty levels improved so much. So we wanted to look at how and why that might be the case. We looked at access to physicians and care delivery services. What we found is that senior housing residents have more access to certain services like cardiology, psychology, and podiatry services. Not only that, but we saw that these care services are more likely to be delivered in the home, right? So we know right off the bat, one of the biggest barriers to care is simply transportation, especially for older adults who may not feel comfortable getting behind the wheel, may not have access to a vehicle. And so being able to bring these services right into their home is just phenomenal. One of the things we found when we looked at health outcomes was, simply put, senior housing residents have lower rates of inpatient admission from the emergency department than their matched peers in the broader community. And when we look at specifics, we know they have lower rates of admission due to physical injury, dehydration, COPD, and UTIs. So we know they're getting care delivered to them. We know they're getting admitted from the ED at a lower rate than their matched peers in the community. And these things all point to strong care delivery, strong wellness programs, and really improved resident health and well-being.